you know your vaginal discharge says a lot about your overall health? Aside indicating the health of your lady parts or an ongoing infection, your discharge color, smell, frequency, and consistency could also be a pointer to a medical condition or a pointer that you have no medical condition. Today I'm going to be discussing with you how to know if your discharge is saying something about your health. Beautiful people, you are welcome back to the channel. My name is Odunayo. I'm a public health specialist, and on this channel we discuss about women's health. We discuss about what to do to ensure that we stay healthy each day. So what are the signs to look out for in your discharge to tell or indicate if you are struggling with a medical condition? I would like to leave a disclaimer before I go into this, that an abnormal discharge is not a major or the only indication of an health condition, but it could be a major pointer that you are struggling with an ailment. Also, provided you discover that you are struggling or you have any of the signs of an abnormal discharge that I'm going to be talking about today, please, I would advise that you don't take it upon yourself to start taking treatment. Ensure that you go to your health facility to run a proper test or a diagnostic center so that you can be properly diagnosed of your condition. Remember, I said that abnormal discharge is not the only pointer to most of these ailments. So let's go into this. If your discharge becomes very thick, white, becomes cloggy, or it becomes very thick, or it becomes yellowish, and then it comes with itching, some form of burning, or you begin to experience pain when you urinate, or you experience pain when you are with your partner in the other room, these symptoms are actually indication of yeast infection. Now, yeast infection is quite common, but the downside to it is this: because yeast thrives in a sugary environment, or let me just say yeast and sugar helps yeast to grow. I think we can understand that better. Where there is sugar, yeast will thrive. So having recurrent yeast infection could actually be a pointer to type 2 diabetes. So when I mean frequent, having to treat yeast infection more than 4 times in a year could actually be an indication that you have too much sugar in your system that is enabling yeast to grow fast. Another major reason why you can start having recurrent yeast infection or recurrent white cottage cheese-like discharge continuously is when there is a presence of an immunosuppressive infection or disease such as HIV. Now, because HIV occupies or engages your immune system continuously to fight the virus, your immune system, you have little or low immune system to fight other infections. So infections like yeast infection can start to thrive because your immune system becomes very low. Now, this is not a scare for you, because most women who do not have type 2 diabetes who are not HIV infected or living with HIV, they still struggle with yeast infection. Some have recurrent yeast infection, probably for issues of hygiene also. But this, if you are clean, you are sure you are clean, but you do not know why you keep having yeast infection, especially if you have more than 4 occurrences in a year, then it is time to speak to your doctor. You could run tests for diabetes, or you could go for HIV screening just to be safe. Another form of discharge that could be a major concern is when you suddenly have increase in your discharge, unexplainable, and it is persistent over time. So the frequency, it just increased, and then it becomes yellowish, grayish or greenish. And then this discharge also is very sticky. So, and sometimes it comes with burning sensation, redness of the vulva, the outer part. It comes with bleeding while you are with your partner in the other room. It comes, when you're also in the other room, it becomes painful, and then you start to bleed. These are indication of a disease or a disorder called DIV. DIV is desquamative inflammatory vaginitis. Vaginitis already from bacterial vaginitis, but this vaginitis is actually not caused by an infection. It is a type of vaginal inflammation that is not related to an infection. It is not related to an infection. In fact, you can take a laboratory test to diagnose. By the time you take laboratory test, it does not show any presence of any form of infection. This condition indicates that cells in your body are coming off or they are shedding. So when the cells around your vulva or inside your lady parts becomes inflamed and affected by this condition, it starts to shed, and then you start to experience those frequent heavy discharge. It becomes yellowish, grayish, or it becomes greenish. That area becomes reddish and painful, and with those other symptoms that I've mentioned. If you suddenly develop this condition, it is an indication that you might be going towards menopause. It is a very rare condition, but it is common with perimenopausal women, that is, women who are moving towards menopause. What else should give you concern with your discharge? If you suddenly discover that your discharge is stained with blood and it is persistent, it is heavy, and it is usually discolored. When I mean discolored, has particles of blood in it, or you start to bleed after you do, then this could be an indication of two conditions. The first one is what we call cervical tuberculosis. That is, there is tuberculosis. Now, this tuberculosis is when the bacteria that causes tuberculosis in the lungs finds its way into your reproductive parts. It is what is called cervical tuberculosis. It is a form of pelvic inflammatory infection also, which we are still going to talk about. It's a form of pelvic inflammatory infection. Another reason why a vaginal discharge can be stained with blood is in the issue of endometriosis. Now, endometriosis is a medical condition in which the lining of the uterus is found in other parts of either the reproductive system or other parts of the body. But if it is found in other parts of the reproductive system or any other part of the body anyway, it sheds just like the lining of the uterus will shed during your period. So because you have excess blood and excess bleeding, especially when the endometriosis occurs around your pelvic area, then you might be experiencing some form of bleeding or your discharge being stained with blood continuously. For endometriosis, unlike tuberculosis that is usually like red, for endometriosis the blood could be pink, it could be brown, it could be black, and it could be active red depending on the type of blood. For this other part is very important. In fact, most ladies are not aware of this, and that is when your discharge is just abnormal. You know what your discharge is month after month, and then you suddenly discover that your discharge becomes abnormal, it becomes heavy, and then it has unusual odor. Since I've been talking, I've not really said anything about odor, but once your discharge begins to smell awful, then there is a sign for concern. The major reason why you could have awful smell shows that there is some form of bacterial growth. It could be an indication of pelvic inflammatory disease, an active infection that has not been treated, especially when it is chlamydia or gonorrhea, and then the infection spreads to the upper parts, enters into the uterus and then goes to the fallopian tube and all. Then the woman can persistently experience heavy greenish or yellowish discharge that has an awful odor. So if you persistently have that and it's as if you are treating and then it keeps coming back, it could be an active indication of pelvic inflammatory infection, which you are going to get tested and treat. Peradventure you experience any of these symptoms, please do not panic. Just try to do a proper test, do a proper checkup, and also so that you can know what actually is wrong. And the major aim of this video is just for you also to know that your discharge can be an indication of something going on in your body, aside the fact that it is an infection from gonorrhea, from syphilis, from trichomoniasis, from yeast or whatever. It could be an active indication that you have an health condition, an ailment that needs urgent attention. Thank you so much for watching today's video. I'm so glad to everyone that has been a part of the growth of my channel. I am so grateful. Thank you so much for your help. Thank you so much for your love. God bless you. And if you have found this video to be very helpful, please ensure that you give it a thumbs up, like this video. And if this community health idea or women's health education is something you would love to be a part of, something you would love to hear continuously, please ensure to click the subscribe button, click on the notification bell so that you can get notified when we drop new videos and be a part of this channel. See you some other time. Please do take good care.